Health insurance. Understanding the type of coverages and their cost is important when choosing your healthcare insurance plan. Basic health insurance covers doctor visits, routine services, hospital and surgical expenses. Major medical insurance covers large expenses from illnesses or injury. Most often, dental and vision cares are sold separately and can be added to the cost of your health insurance protection. Disability insurance covers job-related injuries or illnesses and may be provided by your employer. When choosing your health care policy, keep in mind that it is a binding legal contract. Falsifying information can void your policy. Out-of-pocket costs will include premiums, deductibles, and co-payments made at the time the service is provided. Group health insurance combines groups of people and offers less expensive group rates. Group health insurance policies are usually far cheaper and help cut costs. Group insurance is set by an employer who chooses the coverage that is best for the majority. For any group health insurance policy, be sure that it offers basic health care coverage. Individual health insurance plans are plans in which one person is applying for coverage. People who buy individual health plans might include the self-employed, those whose employers do not provide health insurance, or those unable to buy group insurance through a professional organization or other group. Because you are one person, the coverage will be very expensive. Because every health plan is different, you must read the description of the coverage, exclusions, and deductibles very carefully. Under a fee-for-service plan, you may go to any physician, hospital, laboratory, or pharmacy you want. You share the cost of the medical services with the insurer, usually at about a 20 to 80 ratio after you satisfy your deductible. The managed care plan provides comprehensive medical care to members. Basic characteristics of a managed care plan include these provisions. The member pays a set premium and receives most of the care through the provider affiliated with the health plan. Members make a co-payment at the time of service when it's provided. An HMO is the most common type of managed health care plan. HMO members have a primary care physician, PCP, who provides as a gatekeeper to other services. The physician provides referrals to other doctors and medical services. If you visit a provider outside the HMO, you must pay the entire fee out of pocket. A PPO is more flexible than a traditional HMO insurance plan, but it still operates with a list of physicians and hospitals that are considered within the PPO network. Understand this plan. Physicians and other providers are listed in the PPO network, and members can visit any provider in the network by paying a small co-payment. You do not need a referral to see a specialist. With this plan, you may also visit an out-of-network provider, but you will still usually have to pay the difference between the network and out-of-network prices, or seek reimbursement from your out-of-pocket expenses. The POS plan is like a combination between an HMO and a PPO. You are required to designate an in-network physician to be your primary health care provider. You may go out-of-network if you choose, but in doing so, you will have to pay most of the cost yourself, unless a primary care physician refers you to that specific doctor. A company that requires employees to do a lot of out-of-town travel may offer this type of insurance plan, making it easier for an employee to seek health care when needed. Before you decide on a health plan, ask the following. What is the monthly premium? What is the yearly deductible? What is the copay that you have to pay when you do an office visit? What is the copay for prescription drugs? What is the copay for a hospital stay? What is the copay for an emergency room visit? Is there a limit on how much the plan will pay for prescription drugs in 1 year? Is there a limit on how much the plan will pay for medical care in 1 year? Once you understand provisions and costs of the plans you are considering, the choice is yours.